Control? Obsessions? Absolutely no. There is no way one can control their obsessions.
Is OCD curable?
OCD is definitely treatable and manageable, and it responds beautifully to medication and therapy. So, one can learn to live with OCD while they are doing other things in their life.
How important is medicine in the management of OCD?
Medicine is of vital importance in management of OCD. As a matter of fact, the first line of treatment includes both medicine and cognitive behavioral therapy, specifically exposure and response prevention.
What is exposure and response prevention?
Exposure and response prevention has the highest evidence base in terms of being the most successful technique in management of obsessive compulsive disorder. Exposure to the thought or all the obsessions that are coming one's way and learning the technique of controlling the response or the ritual, the neutralizing, the avoidance that a person does is what entails exposure and response prevention. It is done through an exposure ladder under the guidance of a clinical psychologist.
What can a person with OCD do to control their obsessions and compulsions?
There is no way one can control their obsessions because thought is a regular stream. You cannot control that. You have some control over the actions, which are the rituals, and definitely one can learn how to do that under supervised attention.
What role can family play in supporting people with OCD?
Family plays a very, very important role in management of OCD. First of all, family members need to understand that the time being taken in rituals again is a response of a person to a disorder, and one is not doing it out of, to spite you. Secondly, it is important to remember not to respond to all their requests in following their compulsions. Thirdly, it is important to question why they are doing what they are doing without sounding too critical. Fourthly, it is important to support them by looking at what they are being able to manage instead of criticizing what they are not doing.